It is a problem with no solution in sight. People dying daily on Bay Area streets from drugs.
Fentanyl changed the lifestyle. It's wiped out a whole f***ing generation.
The struggle affecting not only the addicts, but the whole community living amongst scenes like these.
As the drugs change, we've seen these impacts get more and more severe. And our response needs to evolve as well.
But what to do about the problem? An ongoing debate.
And I want them to fear consequences. We have to have a healthy fear of consequences in San Francisco to get our streets to where we need them to be.
They need on-demand detox centers. We need mental health facilities where we can take somebody. We don't need to tell someone, you're ready for rehab? You can get there tomorrow, maybe a week. No, we need to be able to say, yes, let's take you somewhere right now.
This is CBS News Bay Area with Elizabeth Cook.
I'm Ann Makovic in for Liz, and the drug crisis is all too apparent on Bay Area streets, especially in some parts of downtown San Francisco, where people are just dying on our sidewalks. Coming up, we are speaking with a former addict for his perspective and hearing the latest plans from local politicians, comparing them to another city with a major overdose problem, Vancouver, which has tried some unique strategies of its own. To our main story this afternoon, the drug crisis in San Francisco, really the whole Bay Area, but the debate over how to approach it. In the city, it is a major issue in this year's mayoral race, with all the candidates promising to crack down and growing talks of increased enforcement and services. Mayor London Breed and the district attorney, Brooke Jenkins, promised to ramp up enforcement in the Tenderloin and Soma neighborhoods over the last few years. You might remember Mayor Breed declared a state of emergency in the Tenderloin back in 2021. Since then, both Governor Newsom and federal law enforcement have sent their own resources to the area. Jenkins' office says as of July of this year, there have been 128 felony drug convictions for both users and dealers. That number is more than double that of recent years. Jenkins says she's proud of the progress, but that more work needs to be done.
We are here to do a job, and that's to make sure that our streets are safe and clean. And I want them to fear consequences. We have to have a healthy fear of consequences in San Francisco to get our streets to where we need them to be.
Critics of the city's hardline approach to drug enforcement, including many public defenders, say this approach fails to address the causes of drug use and just continues the vicious cycle. City is on track for a slight decrease in the number of overdose deaths this year, according to city data. As of August, 462 people have died from an OD so far in 2024. That is still high, but lower than what we saw over the past couple of years. Most of those unintentional overdoses are the result of fentanyl. The drug is the focus of the federal all-hands-on-deck operation taking place in the Tenderloin as well this summer. The DEA, the FBI, and U.S. Justice Department said it is making a difference. They are crediting the extradition of several alleged Honduran drug dealers and ramped up enforcement on nighttime drug markets in particular. That has led to at least 20 federal criminal complaints.
The devastating effects of fentanyl are visible every day on our streets. My office and the district attorney's office are focusing on the prosecution of street dealers in the Tenderloin and those who supply them.
At the same time, California has expanded its program to distribute naloxone, which can be used to reverse overdoses. It's distributed more than 4 million doses earlier this year to first responders, universities, and various community organizations. There are workers on the front lines every day trying to combat the crisis. Those include community ambassadors with Code Tenderloin. They're walking the streets, handing out Narcan, and connecting drug users to treatment.
We actually go into a lot of the hotels where you don't see people, so we go in and we do follow-ups and checkups. The next day after, they'll say, hey, I want to take you up on that offer and I want to take advantage of this program that you're offering.
In the first month of the program, San Francisco officials say 55 people began addiction treatment. Of course, this problem is not just contained to San Francisco or even the Bay Area. We've been looking up north to Vancouver, British Columbia, to see if there are any lessons we can learn from them. That city has been battling its own opioid epidemic like San Francisco. Fentanyl driving a surge in overdose numbers. But that city has taken a much different approach. They've tried things like opening safe consumption sites and regulating drug use instead of a more hard-lined law enforcement approach. Those strategies caused a lot of division and disagreement in Vancouver, but now the government is signaling a significant change of course toward expanding involuntary care. Wilson Walker has this report from Vancouver.
As the drugs change, we've seen these impacts get more and more severe. And our response needs to evolve as well.
That is David Eby, Premier of British Columbia, announcing a new plan to open what he calls highly secure involuntary care facilities for those with severe drug and mental health issues. And it is a significant change of course.
Fentanyl changed the lifestyle. It's wiped out a whole generation.
When overdose numbers soared, BC famously leaned into an array of harm reduction strategies: take-home naloxone, safe use sites, a regulated safe supply for some users, and advocates for those policies say they are saving lives.
We've done, or the BC Centre for Disease Control has done modeling about the main interventions we've been using, and it shows that we're reducing about a third of the overall overdoses that are occurring. Of course, you don't see those overdoses because they're not happening. So we would see 1/3 more overdoses were we not doing those things.
But critics have argued the province leaned too heavily in that direction, and increased drug freedoms did not come with answers for those struggling with severe addiction.
Harm reduction is very important, but harm reduction has to include a look at the harms, not only on the individual, but the harms on our community and our province as well.
So now a change of course from the top, with hundreds of new beds for involuntary care.
We know that the current response that we offer is not adequate.
Well, Premier Eby, this is the final day of government before the writ drops here, meaning we're entering a cycle of 28 days of campaigning, and then the election for us here in British Columbia is October 19th.
BC Parliament member Eleanor Sturko, who we spoke with in Vancouver, is part of the opposition party. She says the Premier's move reflects an upcoming election and public opinion in the wake of a recent high-profile, unprovoked attack in downtown Vancouver. And while she disagrees with specifics of the plan, she says there is consensus for change.
People in BC certainly have reached a point where, look, we recognize that it's time for a change of direction, which I think is why you see our NDP government, which is a very left-leaning party, and I'm in a very right-of-center party. You know, we've kind of both sides now really pushing for forms of involuntary care because it's just simply the right thing to do.
If you or anybody you know is struggling with addiction, you can call the national helpline. That is at 1-800-622-HELP. It's free, confidential, and available 24/7. Still ahead, we are speaking with a former addict and current treatment advocate about what he thinks San Francisco should be doing to try to curb the epidemic. Welcome back. Today we are talking about the opioid and overdose epidemics plaguing San Francisco, the Bay Area, and other parts of the world. We're also looking at some of the different approaches to try and curb the problem. Joining me live now is a former addict and recovery advocate, Tom Wolf. Tom, thanks for being with us today. I know you're calling for some harsher penalties for addicts and for dealers, working with groups like Together SF, trying to promote abstinence-only policies. We appreciate your time. Can you first tell us a little bit about your own story, how you got addicted and how you got out?
Yeah, well, first of all, thank you for having me. So, you know, I was just your regular middle-class guy, family man, married with 2 kids, working for the city and county of San Francisco. And in early 2015, I had surgery on my foot. I was given oxycodone for the pain to take home. I got addicted to those pills. And over the next 2 years, my addiction spiraled into heroin, and later on fentanyl, which actually led me to homelessness, where I lived on the streets of the Tenderloin for 6 months in 2018, struggling with addiction. And I got off the street because I was held accountable. I got arrested 6 times in a 3-month period for various crimes that I was committing. And I want to stress that, you know, addiction itself, it's not necessarily illegal to be a drug addict, but it is illegal when the behaviors that you that you exhibit within your addiction cause you to break the law, like shoplifting is an example. And it was through that accountability that I was eventually able to find treatment and find recovery. And now I'm 6 years clean and sober.
Now, for people who have not gone through addiction, I think it's difficult for them to understand how somebody who's living a normal life, maybe in the burbs, could end up looking like some of these people on the streets that are just, I mean, looking like they're just at the end.
Yeah, well, addiction doesn't discriminate. Our response to addiction sometimes can be discriminatory, but the disease of addiction itself can get anyone. Rich, poor, white, black, it doesn't matter who you are. If you have that predisposition to addiction, or if you have circumstances and trauma that are happening in your life that can lead you to self-medicate, you can absolutely become addicted. And, drugs aren't free. I spent well over $100,000 on drugs in my addiction, and that's, it bankrupted my family. I almost lost my home to foreclosure, and it, led me straight to the street.
So, right, when you're out of money, you end up turning toward crime. That's the story for a lot of people. But when we're talking about arrests, the last 60 years of the war on drugs has certainly proven that that's not necessarily an effective solution in and of itself to dealing with drug addiction. What else can the county of San Francisco do?
Well, it's all about finding a balance. So you're right, the war on drugs didn't work all by itself, but this kind of permissive harm reduction that we're doing now, and decriminalization like what they tried in Oregon, that's not working either. So it's really about finding a balance between compassion and accountability. There's a subset of people on the street that require intervention. As a result of that and as a result of that, that means that law enforcement has to be involved, and they do play a role in all of this. And that subset's going to sometimes require mandated treatment through drug court. And that's what things like Prop 36 are going to bring to California if it passes next month in the election. So, things are changing. I think we realize that we have to stop the pendulum in the center and actually find that balance between accountability and treatment and compassion for everyone out there.
And so, do you think it was sort of this compassionate state that got us to where we are, that we're, the center of the opioid epidemic in the U.S.?
Well, I think we were over draconian in the 80s and 90s. You could go to jail for 3 years for having a $5 crack rock in your hand, and that's too harsh of a penalty. But the pendulum swung all the way to the other side, where in states like Oregon, they decriminalized up to 3.5 grams of fentanyl, so you could actually really be a drug dealer and have a small amount of drugs on you, and nothing would happen to you. And that's not the answer either. The answer is going out there and doing outreach on the street and finding out who those people are that require that type of intervention, whether it be people who are breaking the law or people that are so sick, like out there with abscesses and sepsis and MRSA and bacterial infections that you see in wheelchairs on the street that need some type of intervention to get them the help that they need.
All right, Tom Wolf, we really appreciate your inside perspective on this problem. Thanks for sharing your time this afternoon and your story. We're going to be right back.